Let's discuss Menieres disease, which is also known as idiopathic, meaning we don't know the reason why, endolymphatic, meaning to say a disorder of the endolymphatic channel in the inner ear, the cochlea, and of course the vestibule as well. It's just the middle channel of the cochlea and the vestibule. Hydrops, a swelling of the middle channel of the vestibule and the cochlea. And this shall become very clear in the next slide when I discuss it, okay? This disorder is usually one-sided and happens basically mainly in ladies between the ages of 40 to 60. There are attacks of dizziness or vertigo, vertigo meaning a spinning sensation, dizziness or vertigo. There is hearing loss. There is tinnitus, buzzing or ringing sound in the affected ear, sensation of fullness in the affected ear, and the symptoms tend to come and go initially, come and go from one side only. And the symptoms may last from 20 minutes to 8 to 12 hours. And when the symptoms occur, it causes prostration. You cannot just stand upright. You have to lie down or fall flat or something, or grab onto something. Okay. And what's affected are the lower frequencies first. The lower frequencies of hearing are affected first. And the symptoms tend to progress over time unless treatment is done. So let's move to the next slide. Over here, I'm showing a cutaway section of the cochlea. You find that there are three channels all connected to one another at the top. The middle channel is called the scala media. It contains endolymph. And there's the scala vestibule. It's called the upper channel. Scala tympani, the lower channel. This is called the scala media, the middle channel. What happens is that fluid collects here and sometimes may burst through these little membranes. And this causes the tremendous dizziness that can happen. Okay. Remember that these little channels extend all through the organ of sound and the organ of balance. So obviously everything is being affected here. So how do we treat it? Treatment is by a low salt diet, by diuretic pills, by anti-vertigo medications. And if, of course, the patient is unrelieved, we sometimes have to destroy that inner ear through intratympanic, that is through the middle ear. We have to inject gentamicin or toxic drugs into the middle ear to destroy this channel so that dizziness doesn't affect him. Okay, basically destroy the labyrinth so that the dizziness doesn't happen from that side anymore.